In today's video, I'm going to be talking about sarcoidosis. Sarcoidosis is what's known as a granulomatous disease, which means that these masses of granulation and immune tissue called granulomas form around the body. In this histology slide here, we have a slice of lymph node, and you can see the granulomas as I'm circling them. Sarcoidosis is also a multisystemic disease, meaning it can affect any of the different systems of the body. I'll talk about this more when we get onto the signs and symptoms, but the most commonly involved organ is the lungs. But other frequent sites include the skin, eyes, and the heart. So, what causes all of these granulomas to form? Well, although certain alleles have been linked to sarcoidosis, we don't actually know for sure what triggers a disease to develop in patients. Before we get on to the details, let's just have a brief look at the demographics. For reasons we don't yet understand, there's both a high frequency and high severity of the disease in those who have Afro-Caribbean origin. Northern Europe, which includes the UK, has the highest prevalence of around 10 to 20 per 100,000. It's also more common in women, and the typical age is somewhere between 20 and 40 years old. Many cases of sarcoidosis are actually asymptomatic and diagnosed incidentally. But for those who do have symptoms, lung involvement will classically cause a dry cough and shortness of breath that worsens with time. There are also likely to be more vague symptoms too, such as fatigue and weight loss. Different types of lesions can form on the skin in sarcoidosis, but the classic find is usually called erythema nodosum. These are painful red blotches that are usually found on both shins. If the eye is affected, then the uvea can become inflamed, which is this part that I'm lining out here. Symptoms of this are often quite mild, such as dry eye and blurred vision. And in the heart, we can get heart block and cardiomyopathy. Rarer areas of involvement include the kidneys, but also the central nervous system, and when granulomas occur in the latter of these, we call it neurosarcoidosis. This can cause Bell's palsy, which is palsy of the facial nerve causing one side of the face to droop like this. There's no one set test that diagnoses sarcoidosis, but here is a list of some of the tests that we can use in conjunction with one another. Perhaps the most important of these is the chest X-ray. And on the chest X-ray, the classic finding here is bilateral hilar lymphadenopathy, which I'm circling here. The lymph nodes of each hilum are enlarged, as you can see. This is the one thing we can also observe in those who are asymptomatic as well, and so these patients are usually diagnosed when this is found on a routine chest X-ray. From blood and urine samples, you may find hypercalcemia, because there's an increase in the enzyme that activates vitamin D, and vitamin D increases blood calcium levels. ACE is increased, as in any inflammation of the lungs, so this is a non-specific sign. And if you perform spirometry, you'll find results that align with what you'd expect from a restrictive lung disease. Heart involvement can also lead to abnormalities on the ECG, as you'd expect. In a tissue biopsy, you'll see granulomas as we saw earlier, but in sarcoidosis specifically, these granulomas are what we call non-caseating, which means in the centre here, they're full of macrophages and multinucleated giant cells, rather than the necrotic, cheese-like tissue that you'd find in a caseating granuloma caused by tuberculosis, for example. The level of progression of sarcoidosis in a patient can also be put into stages, with stage 1 there being bilateral hilar lymphadenopathy only, in stage 2 there being both BHL and peripheral pulmonary infiltrates, which can look a bit like pneumonia and can be seen on a chest radiograph. In stage 3, there are these infiltrates only. And then finally, in stage 4, there is progressive fibrosis, which leads to honeycomb lung when this becomes widespread, and also pleural involvement. In this pathology specimen here, you can see these characteristic cystic spaces that look a bit like honeycomb, which is where the name comes from. In patients who are stage 1, or in other words, have BHL as their only finding, treatment is often not given beyond NSAIDs and bed rest in acute cases, since this often does tend to resolve by itself without any intervention. In more widespread and severe cases, though, we can use corticosteroids, such as prednisolone. The indications for when we would treat a sarcoidosis patient with steroids are the presence of eye, CNS and or heart involvement, raised calcium levels, and parenchymal, otherwise known as interstitial lung disease. This is when the tissue and space around the alveoli become involved. So that brings us to the end of today's summary of sarcoidosis. If you found this video useful, then click on the subscribe button and thanks for watching.